Okay, welcome to the Advocator Group's webinar talking about the Medicare Annual Enrollment Period. Today, the Advocator Group is hosting this webinar. We are an organization that primarily works with Social Security disability insurance. Those of you who are on Social Security disability, once approved for that, you will also automatically be entitled to Medicare benefits. So this is now a new area that we are also working to assist our clients with. It's a way that we can help them identify the optimal health insurance options to meet their unique needs. Today's presenter, my name is Adam Roy. I'm a licensed Medicare specialist here at the Advocator Group. Today what we'll be covering is the topic of Medicare. What is Medicare? We'll also be talking about the Annual Enrollment Period, or it's called AEP. We'll also talk about who can utilize AEP, because there are certain people that can and cannot take advantage of this period. We'll talk about health plans and their renewals or cancellations, and we'll also talk about some special enrollment periods or SEPs that might also apply alongside of the annual enrollment period. Now, lately, the government shutdown has been a hot topic in our society, and we've just gone through one. There could be the potential that we might have another one coming up in 2014. Regardless of what has happened, what could happen, a government shutdown will not affect your Medicare benefits. If you have a Medicare health plan such as an Advantage, a Medicare supplement, or a prescription drug plan, again, they will not be affected. You will still maintain your coverage and the plan will operate as normal. So talking about Medicare, first off, we want to make sure that everyone is on the same page and talking about the same subject. So Medicare itself is a health insurance program. It is not welfare, and it's not Medicaid. Medicaid is an assistance program to help you with some of your medical costs. Medicare is health insurance, and it's specifically designed for people who are on retirement or people who are found to be disabled. The annual election period is a time each year when Medicare beneficiaries can choose a health plan, or they can elect a different health plan if they're already on one. So AEP, the annual enrollment period, it spans each year from October 15th through December 7th. And then those plans will go into effect on January 1st the following year. And again, the AEP, it can only be used by people who are actively enrolled in Medicare, and it's often called open enrollment time. The official name is the Annual Enrollment Period, and this is a way that you can review the plans coming down the road for 2014. So to review the parts of Medicare, we have Part A, which is hospital insurance. That covers most inpatient services. We also have Part B, which is medical insurance. That covers outpatient services. Together, these are called Original Medicare. And from here, there's two pathways that you can go. You can keep your Original Medicare and pick up a Part D prescription drug plan. This is a way to have your medications covered. And with that, you can then also add a Medicare supplement plan or a Medigap plan. The Medigap plan is designed to fill in the gaps where Original Medicare doesn't pay. So this plan would help you cover your A and B costs. The other way we can go is with a Medicare Advantage plan or a Part C plan. A Part C plan is where all the benefits of Part A, Part B, and usually Part D are all offered through a private insurance plan. Essentially, this will replace Original Medicare. And with the Advantage plan, oftentimes there's some extra benefits thrown in there like dental, vision, or hearing. Now, we often get a question from clients saying, I don't know what plan I have, how can I find that out? The easiest way for us to identify the plan from our position is to ask you, what do you do when you go to the doctor or pharmacy? So, do you use the same private insurance card at the doctor's office and the pharmacy? If so, you probably have a Medicare Advantage plan. And again, that's because a Medicare Advantage plan combines the medical and prescription coverages. Now, if you use your red, white, and blue Medicare card at the doctor's office and then a private insurance card at the pharmacy, most likely you have a Part D plan, and quite possibly you would also have a Medicare supplement plan to help with the costs of your A and B hospital and medical benefits. So talking about what you can actually do during AEP, for those of you who just have Part A, this is the time when you can either add or change your prescription drug plan. For those of you who have A and B original Medicare, you can either add a prescription drug plan and a supplement plan, or you can add an Advantage plan, or you can change any of them. You could change your prescription drug, supplement, or your Advantage plans. Now, for those of you who are currently on an Advantage plan, you actually have the opportunity right now to disenroll from that plan. From there, you could return to original Medicare, and then you could add a Part D prescription drug or a Medicare supplement plan. If you do not have Part B right now, you are not going to be eligible for a Medicare Advantage or a Medicare supplement plan. It is a requirement that you would keep Part B or have that actively on your Medicare account to be able to use a Medicare Advantage or supplement plan. If you don't have Part B right now, you'll be able to sign up for Part B in January during the general enrollment period, but those benefits will then not go into effect until the next July. Now, most of the time during AEP, the health plan that you're on will automatically renew for the following year. And if you're happy with your plan, you don't have to take action. It is important just to note that the premiums or the service costs for the plans might change, so you should probably check in with your plan provider just to see if there have been any adjustments. But again, if you're happy with the plan, you don't have to make any changes. It should automatically renew for the next year. Now, the insurance carriers should notify you if your health plan will not continue for 2014. Usually you should receive this in a letter from the insurance carrier. And if your plan is ending, you actually have some additional time to make an election for the next year. You would have a Special Enrollment Period, or an SEP, and that is from December 8th through February 28th. And this is in addition to the Annual Enrollment Period from October 15th through December 7th. Now, it's ideal to be able to make your election ahead of time, but in case you weren't notified properly, there's an extra buffer time zone here with this special enrollment period to make sure that you can have an effective plan in place for next year where your current plan is being canceled. Now, there are also some additional special enrollment periods that you can also utilize in addition to the AEP as they may apply to you. So one of the most frequent special enrollment periods we see is if you move out of your health plan's service area. So if you move to a different county, if you move to a different state, you're eligible for a special enrollment period to make an election for a new plan. If you become eligible for extra help or the low income subsidy, that's assistance with your Part D premiums and costs for medications, then you're eligible for a special enrollment period and you can make a new election. If you become eligible for Medicaid, or if your Medicaid eligibility ends, either way, you're eligible for a special enrollment period. And as we previously discussed, if your health plan is being canceled at the end of the year, that also will be a special enrollment period that you can take advantage of. So this concludes the webinar about the annual enrollment period for Medicare. I hope this has been informative to you. If you do have any questions, please feel free to give us a call at our toll-free number here at the Advocator Group. It's 877-406-4646. 5160, and we'd love to be able to talk with you and to discuss some options available to you coming up for next year. So please give us a call. We'd love to hear from you. Thank you.